A young man presents with severe wrist pain and deformity after falling off his bicycle. I am showing you PA and lateral radiographs of the left wrist. Describe the findings.
Okay, looking at the images. The PA radiograph of the left wrist demonstrates disruption of the normal carpal arcs, and the lunate bone has assumed a triangular or pyramidal configuration instead of its normal quadrangular shape. The lateral radiograph depicts volar displacement and tilt of the lunate bone, which is completely dislocated from the distal radial articular surface. The capitate bone, however, remains aligned with the distal radius. No acute fracture of the scaphoid or other carpal bones is identified. These findings of volar displacement of the lunate with loss of the radiolunate articulation are diagnostic of a lunate dislocation.
Explain the Mayfield classification of carpal instability and how a lunate dislocation differs from a perilunate dislocation.
In that case, carpal instability is classified into 4 stages using the Mayfield system, which represents a progressive ligamentous disruption under hyperextension and loading. Stage 1 is scapholunate dissociation, with tearing of the scapholunate ligament. Stage 2 is perilunate dislocation, where the capitate dislocates dorsally relative to the lunate, but the lunate remains normally aligned with the radius. Stage 3 is midcarpal dislocation, where the triquetrilunate ligament tears and the capitate is dislocated. Stage 4 is lunate dislocation, the most severe, where the lunate is expelled volarly, losing its alignment with both the radius and the capitate, while the capitate moves dorsally to align directly with the radius.
What are the key radiographic signs on the PA and lateral views that help identify a lunate dislocation, and what else should we look for?
Well, on the PA view, rotation of the lunate causes it to lose its normal trapezoidal shape and appear as a triangle, which is the piece of pi sign. There is also disruption of Jalula's carpal arcs. On the lateral view, the volar dislocation and rotation of the lunate resembles a spilled teacup, which is the spilled teacup sign. The radiolunate cup is tilted forward, and the capitate sits behind it. It is critical to carefully interrogate the scaphoid for a waist fracture or rotatory subluxation, which can present as the signet ring sign, representing a transscaphoid perilunate or lunate dislocation.
What are the potential complications of an unrecognized lunate dislocation?
Okay. An unrecognized lunate dislocation is a surgical emergency with serious complications. The volar displacement of the lunate can directly compress the median nerve within the carpal tunnel, causing acute carpal tunnel syndrome with pain and numbness. Prolonged dislocation also disrupts the blood supply to the lunate, which classically enters through the volar and dorsal ligamentous attachments, leading to a vascular necrosis of the lunate, known as Kienbuck's disease. Chronic instability also leads to progressive osteoarthritis of the radiocarpal and midcarpal joints.
How would you manage this patient as a radiologist?
As a radiologist, I would recommend comparing these films with any prior wrist radiographs. I would suggest obtaining emergency orthopedic consultation because this is a surgical emergency that requires urgent closed or open reduction. I would recommend evaluating for signs of median nerve compression clinically. Finally, I would document the findings, check for associated fractures of the scaphoid or radial styloid, and refer the patient to hand surgery for surgical ligamentous repair and temporary Kirschner wire fixation.